Liz has routinely assisted with special projects and has also partnered with the Richmond Public Affairs Specialist team to support the Social Security Administration's mission. Lizna has received numerous awards for her dedication to the mission of the agency, including a commissioner's citation. We are so excited to have her here. One more thing I would like to mention to you all, if you have a question following the presentation, please contact your local office or visit the Social Security website at www.ssa.gov. And we'll mention this again at the end of the program, but I know that Liz will do such a terrific job, you will have no questions. So please welcome Liz and take it away.
Hello, everybody. Thank you so much for such a nice introduction, Ms. Jennifer. My name is Liz, and I'm with the Social Security Administration. And again, as she mentioned, you're in great hands. I've been with the administration 18 years. I've been in a lot of different offices. So, and you guys will be able to see this presentation. To my understanding, it is being recorded. So you guys will be able to access it with NAMI Coastal Virginia's organizational webpage, along with some links that I will be able to provide afterwards. So it's a great organization. It's a wonderful support group, and I'm happy to be here. It is our pleasure to be here because we do serve mutual clients. So I definitely hope that everybody gets a lot of good information out of this. So the next slide talks about the My Social Security account. So today we're going to be talking about Social Security disability benefits and the two programs, disability and supplemental security income. So we're definitely going to be highlighting that. But I will introduce, I will start the presentation letting everybody know that at this time, Social Security offices, you can't go in due to the coronavirus, right? Because we're trying to practice social distancing, and we're really going by safety. So when the states announce a specific phase, phase 1, phase 2, we are not going by that. We are going by safety. And as you guys are aware, we do serve the most vulnerable population, pretty much the elderly and the disabled, and then everybody else comes in for whatever need they have, like a Social Security card, or so we cannot open up our offices like that. So that being said, you are able to transact a lot of business online if you need your Social Security card replaced and you're over the age of 18. You can actually order it online and it's free of charge. So the next slide after this talks about how you could do that, right? So as you can see, the website, as Ms. Jennifer mentioned, is www.ssa.gov/myaccount. And you can pretty much download this anywhere. You could you could go to the website on your smartphone, on your tablet, on your lunch break. You don't have to take the day off to go into an office to transact a lot of business. For example, like I said, if you need to get your Social Security card replaced, that's available as long as you're over the age of 18, you're a US citizen, and you just need a replacement. So if you're trying to change your name or something else, you cannot do that online. But if you're just asking for a replacement card, that's available. And if you guys remember, we used to send out these nice green and white statements in the mail. And we stopped mailing those out because of identity theft. So we want everybody to know that you can access those green and white statements even if you were in your 20s and 30s. You used to get these statements every year around your birthday. And that was because you worked and paid into Social Security. So it is important to, and I'm going to be going over some benefits even for family today. But just know that if you need to access those green and white statements because you're not getting them anymore, it's because of identity theft. We stopped mailing those out. So it is important to understand that if you need to access those, that's also available online. So you can even access your statement online. You can actually file for some of the benefits that we're going to be talking about today online as well. So it's great to have, and I have one too. I check out my statements every year as well because I'm working and I want to make sure that my benefits are right in the future. So I want to make sure I check my earnings. Now the next slide after this talks about how do you open up your Social Security account. So as you can see, it's a fairly easy process. You visit socialsecurity.gov/myaccount. You sign in or create your account. Now, again, if you're just trying to get information, you could just go to our website, as Ms. Jennifer mentioned, www.ssa.gov. But this is specifically to create your account, again, to get your Social Security card, your statement, file, take care of some transactions like reporting wages if you're on disability or SSI. So again, you provide some additional information and you create a username and password just like anywhere else, like any other online account. No different. You just have to remember what it is. And every time you log in, you will get a text message or an email with a security account, security code, so you could log in with your code. Okay. So the next slide talks about if you don't receive benefits, why would you need an account, right? So as I mentioned, you can request your replacement Social Security card if you're pretty much a US citizen and you're over the age of 18, okay, and you just need a replacement card. Let's say you filed for benefits online or even over the phone, because right now we are doing claims over the phone. You can call us, you can call any local office, or we have an office locator link that you could just put in the zip code and you can find the local office anywhere in the United States. Office hours are still Monday to Friday, 9 to 4. That has not changed. And again, you could do appointments over the phone, or you do the claims online. And the website to get to the office locator is the same, ssa.gov, G-O-V. Not .com, not .org, not .net. We want you to make sure it is .gov, so ssa.gov/locator. And I will send this out as well, but if you just do that, you can put in your zip code under the zip code link, and then you can go ahead and find the local office to you. So if you need to call us, you can still call us. We're not asking everybody to just do transactions online. And you can, even if you file your claim, if you want to know the status of your claim, you could actually get the status online. So you're not calling us to know what's going on. Is it back yet? Is it still being reviewed, right? You can get, if you need verification that you're not receiving benefits, because let's say you're filing for something else and you need proof that you're not on Social Security, like unemployment or housing or whatever it is that you're filing for, whatever other resource, you can actually get a statement stating you're not getting Social Security. So if you need that, that's available without calling or going into the office. Again, you can see your estimates online. You could plan for your retirement and your disability. There's a disability checklist. You can do all of that online as well. And of course, more importantly, you want to review your statement, because not only does that affect your money, but it affects your family's money. Now, the next slide after this kind of goes into the statement a little bit. So the slide after this is a screenshot of the nice green and white statements that I'm mentioning today. Again, these are all housed, whatever you've worked and put into Social Security every year, even if you're starting work, even if you're 18 years old or 15 years old and you've just started working, everything is housed online. So if you have a My Social Security account, you could actually track it. So as long as you're working and paying into Social Security, which most probably you are if you are working, because most employers do take out FICA, Federal Insurance Contributions Act, or Social Security, or OASDI, whatever is showing up on your pay stub. It's automatic. You don't have to really pay into it because you're working. So this is the statement that you can actually see online. And the next slide after this hones in on benefits. And this is important because when we're talking about retirement, we're looking at the highest 35 years of the last 40 years of work. When we're looking at disability, because again, if you've worked and paid into Social Security enough, you could also get disability benefits. So when we're looking at disability, we're really looking at the last 10 years of work, specifically the last 5. So we're looking at the last 10, but we're going to use calculations for the last 5 to see if you're insured for disability. Family benefits, right? When you're working and paying into Social Security, the statement also has a section on what your family could get, what your spouse could get, what your minor children can get. What if you pass away? You know, survivor benefits. And what if you have a disabled adult child? So if you have a child that was declared disabled through the SSI program or the Social Security program before the age of 22, and let's say you're filing for your retirement, now you're 62, right? So your child is probably now 40, right? And they're getting a benefit from this SSI or Social Security as an adult. Well, you can actually claim that child as a disabled adult child, and they could get benefits off of your record. When you file for your retirement or your disability, or if you pass away, they can get something off of your record. So it is important to understand that this is really for life, and it's also for your family, which brings me to the scam calls. If you're getting those calls telling you, hey, your number is suspended, or the police is looking for you, or something crazy like that, your number never gets suspended. So if you're getting a scam call like this, even after you pass away, your number is still your number. It's assigned to you for eternity, infinity and beyond, because your family could be getting benefits off of your Social Security number, right? So it never gets suspended. So if you're getting a call like that, just know that is fraud. You can hang up on those calls. And you can report those calls as well to oig.ssa.gov, which I will provide. But again, that is oig.ssa.gov. So this is a good screenshot letting you know of what your benefits could be. And this changes every year because every year you're working, you're actually putting into it, right? So it could grow. Or if you're not working anymore, it's going to stay the same. So the slide after this is your history. And this is very important to track because you want to make sure that we have the right numbers. Your employer is providing us the right information. And if you have a W-2, then you can actually just compare to what you have on your W-2 every year and call it a day. You want to be proactive, not reactive. Because you never know what's going to happen in the future, and no one is really going to look out for you other than you, right? So you want to make sure that your numbers are right. You want to make sure that your amount is right, because let's say you're going to file for disability or retirement in the future. You're not going to remember what you made in 2020 if you don't get those statements anymore. So it is important to know, to kind of keep track of what you've worked and put in and what we have in our system, because this is your benefit, this is your money. And as long as you have a W-2 and you see that there is a discrepancy, or if you're self-employed and you have your tax returns, you can contact the local Social Security office. We could mail, we're still transacting business by mail and by phone. So you could mail in the correct W-2 with the year, and we'll be able to update it with your, we'll be able to update it with what you have, as long as you have the W-2 and the tax return. So again, we are able to update these things for you, even if it's 5-10 years down the road. But if you have your W-2 or your tax return, we will be able to update it, because again, this is your money and your benefits and your family benefits too. So the next slide after this is a quick comparison of Social Security disability insurance and supplemental security income. So those are the two disability programs that Social Security offers. Now, Social Security disability insurance, you see that amount on your green and white statement because you've worked and you've paid into Social Security, right? So it has that disability section on there. And supplemental security income is based on need. So that's more of a, there's a financial screening involved with that. Okay, so I'm going to go ahead and go through, compare the two. So Social Security disability insurance, on the first box, it says payments come from Social Security trust funds and are based on a person's earnings, versus supplemental security income are payments that come from the general treasury fund, not Social Security Trust Fund, because they're not working and paying into it. SSI, which is supplemental security income, are not based on a person's earnings. So that's why I said you'll only see Social Security disability insurance. And again, if you notice, it's insurance. The more you put in, the more you get, because you paid into FICA, which is Federal Insurance Contributions Act, right? So it's pretty much like an insurance policy, whereas supplemental security income is not called insurance. So again, it's not based on a person's earnings. SSI, or supplemental security income, is based on need. The second two comparisons: Social Security disability insurance is an insurance that workers earn by paying Social Security taxes, or FICA, OASDI, or sometimes it'll just say Social Security on your pay stub, on their wages, right? Which is 7.6. It's 7.65%, 7.62%. So every time you work, you're paying 7.62%. Your employer is matching it, and then that's why you're going to get a little bit over 15.3%. So that's how in Social Security works, whether you're getting it retirement, disability. Every paycheck you work, you have that deduction for Social Security, and that's close to 7.6, I think it's 7.65%, and then they match it. So the employer matches it, and that's why you get a little bit over 15. Whereas SSI is needs-based. It's a needs-based public assistance program that does not require a person to have a work history. Even a baby can get SSI. So if you have let's say you had a baby, premature birth, low birth weight, and they're expected to be in the hospital for more than 30 days, the parent can even apply for the SSI for the baby. So that kind of gives you an idea that you don't have to work if you're on a supplemental security income for that program. So there's no work history requirement. The third comparison is that it pays benefits to disabled individuals who are unable to work regardless of income or resources. So at this time during the pandemic, as you guys are aware, there's a lot of people that had to file for unemployment because they lost their job. And the most common question I've been receiving is, will unemployment affect my disability? Will unemployment affect my benefit? And it depends on what kind of benefit you're receiving. So if you're receiving Social Security disability insurance, then no, unemployment will not affect Social Security. Pensions, veterans benefits, retirement pension, anything like that, another disability insurance you're receiving, that's not going to affect it. But for supplemental security income, it will. So supplemental security income pays disabled individuals who are unable to work and have limited income and resources. So again, two different programs, even though you do have to be medically approved for both, okay? And I'm gonna go through the medical questions in a little bit. Again, Social Security disability insurance benefits for workers and for adults disabled since childhood. As I mentioned, even a child can get it off of a parent's record if they were declared disabled through Social Security or the SSI program before the age of 22, and they must meet the insured status requirement. So either they've worked and paid into it enough or their parents have, right? Whereas benefits for children and adults in financial need. So again, it's limited income and resources for SSI. Now, the next slide after this, I'm going to go into Social Security disability insurance. So this is regular Social Security. The slide after this defines it. So what do we look at when we look at disability? So a person who cannot work due to a severe medical condition that has lasted or is expected to last for more than a year. And this applies to both. So this applies to both Social Security disability and SSI, because we're looking at the medical portion. Like I said, non-medical, you have to be insured for Social Security based on work, whereas for SSI, supplemental security income, it's based on need. So a financial screening is with the supplemental security income. But disability is going to be, the definition to meet medical is the same. So it can't be, if a person comes in and they say they're pregnant and they want to file for Social Security disability, they're not going to be eligible, because normally a pregnancy only lasts 9 months, right? Not more than a year, right? So that kind of just gives you an idea that the condition has to last for more than a year. Now, also, the person's medical condition must prevent him or her to do substantial gainful activity. Now, when we're talking substantial gainful activity, or substantial gainful employment, we actually have a dollar amount set to that. So when we're mentioning that, we're saying in 2020, and again, these are 2020 rates. In 2020, if a person is on disability, or if they're saying that they have a condition, they can't be making more or working. They can't be working and making through earnings more than $1,260 a month gross. So again, that's $1,260 a month gross. That's before taxes, before anything is cut. So when you come into the office and you initially want to file, or you do it online, or you do it on the phone, if you're making $1,500 a month, you're not going to be eligible. So in 2020, the cap, if you want to apply for working, if you're working, you can't be making more than $1,260 a month to be declared disabled. Again, you have other income, that's different, but when it comes to wages, you can't be making more than that, okay? And again, it has to make you adjust the type of work you did in the past, because now you have a condition, right? Now, the next slide after this talks about, again, you have to work in order to get regular Social Security disability. And we also look at how long you've worked, right? So we're going to be looking at the last 10 years. So that's with Social Security disability, different than supplemental security income. Now, the next slide after this talks about when should you apply for benefits. So if you notice, I mentioned that you got to be disabled for more than a year. That does not mean that you apply after your year. You could actually apply as soon as you become disabled. As soon as something happens to you and you've worked and paid into Social Security, or you think you could meet the low income requirement for supplemental security income, you apply. A lot of times you're in the hospital and they have somebody there that will help you apply for benefits too. It has to expect to last for a year, but you can apply. Let's say you had a car accident and you're not going to be able to go back to work and make what you were making before. Or let's say you got diagnosed with something and you know that you're not going to be able to go back to work. Then you apply then, okay? You don't wait a year. Because when we send up your application for a medical decision, it could take up to 3 to 4 months for a medical decision to come back, right? So that's why you want to take care of it as soon as possible, because you're going to need the money, because now you're limited in how much you can make, right, with your job. And again, the more information we have, the sooner we can get a medical decision back. Now, the next slide talks about, well, how do you apply, right? So as I mentioned, you can do it online. It's socialsecurity.gov/disability. Remember, you have everything online at your fingertips. You have your statement. You know how much you've worked and put in. It tells you how much your disability amount's going to be on your statement if you've worked and paid into it. So you can do it online. You can even apply for supplemental security income online. As long as you're between the ages of 18 and 65, you're a U.S. citizen, never had a name change, never been married, you can act, and you've never filed before. So let's say you have an 18-year-old who needs to file for supplemental security income now, because before we looked at parents' income, because when the child was under 18, we looked at parents' income, right? So once they turn 18, they're considered an adult. So if you have a child that's now an adult, might not act like an adult, but legally they're an adult. If you have a child in that situation, you can actually go ahead and apply for Social Security disability. And then in that application, they're going to ask, are you interested in filing for supplemental security income? You're going to say yes. And then it's going to do the financial screening for the supplemental security income questions, right? And that's important, because even $1 worth of SSI, supplemental security income, will get you Medicaid. Most people do it just for the Medicaid insurance, because see, Social Security will help you with Medicare, right? When you work and pay into FICA, a little bit over 1%, I think it's 1.45%, is going towards Medicare. So, but your SSI, you haven't worked and paid into it. So that's what qualifies you for Medicaid, and that's through the state. That's through social services. But you can go ahead and do both of these applications online if you have a child that's 18 that needs to file for benefits. Because remember, if they're still disabled before the age of 22 and they're still getting benefits even after that, and now you're filing, you could actually cover that child as under your family benefit as a disabled adult child, right? And that's important. Now, again, you can always call the 1-800 number, which is our national number, 1-800-772-1213. But you can always call our local offices too. And we do have people answering phones. Everything is now over the phone. So that's going to be on ssa.gov, www.ssa.gov/locator. So you can put in the zip code and get your local office with their address and fax number if you need to fax something. Now, the next slide after this asks you, well, what happens? Now that you've filed, what happens? Well, we actually review it to make sure that you're insured, you meet the non-medical requirement for financial screening for the supplemental security income, or you have enough credits to get the disability because you worked and paid into regular Social Security disability insurance. We check to see if you have enough work credits, if you're, depending on what program you're filing for, right? Because we just went over the differences. And then we forward it over to the state. We forward it over to, we contract out to the state, and we call them the Disability Termination Services. So DDS, Disability Termination Services. So we actually send your case over because we're not doctors. So, you know, we might see a lot of people, but we're not doctors. So we have to send it up to make sure that it meets their requirements for the disability. Okay. So the next slide after this talks about what disability determination services is, right? So as you can see, it's the state agency. It's a state agency that completes the initial disability determination decision for us. So again, they're doctors and disability specialists, and they work for the state. If you've heard of DARS, they're part of DARS, okay? And they ask your doctors the information about your condition to see if they qualify or not for the condition. Again, this is different than the non-medical requirements, because medical requirements for both Social Security, disability insurance, and supplemental security income is reviewed by the state doctors. So that's why there's no difference in that other than if you're a child or an adult. And then again, they'll use the medical evidence from your doctors, hospitals, clinics, and institutions to get the medical records. Now, what are they going to ask your doctors? I'm going to go over that real quick. They're going to ask your doctors about what your medical condition is. So you're going to tell us what your condition is, but we have to know what your medical condition is. And we have to know it from your doctors, right? Now, that does not mean you have to provide medical evidence to us. If you have it and it's free, it's available to you, we could make a copy, you know. But if you don't have it, we do not want you to pay for it. We will get the medical records from your doctors directly. And that's why the application is pretty lengthy, because we're asking you questions about your doctors, you know, what medications you're taking, what tests you've had, and this is the reason why. So we want to know, you know, when your medical condition began. So they're going to ask your doctors about that, how your condition limits your activities, right? They need to know, you know, are your activities limited due to your condition based on what you could do before, or, you know, then whatever it could be, your medical test results, and then the treatments, what treatments you've received, like what meds have you taken, if you're taking physical therapy, if you have, you know, a counselor, you know, something like that. So they'll also ask your doctors about your ability to do work-related activities, such as walking, sitting, lifting, carrying, and also remembering instructions. You might have somebody who might not have a physical disability, but they might have a mental disability, right? So that an intellectual disability. So they will ask about, you know, remembering instructions, and if they can, you know, what capacity, you know, you could do that. The doctors don't decide, your doctors don't decide if you're disabled, which is the same thing like the VA. a lot of people ask us, well, I've been declared disabled through the veterans, right? The Veterans Administration. So does that mean I'm also disabled through Social Security? No, because we're looking at Social Security rules. We're trying to figure out if you're working, are you able to work and make more than $1,260 a month before taxes? Whereas veterans disability, you could still work, right? So it's different criteria, okay? And again, the state agency staff, like I mentioned, they're going to ask if they need to reach out to you or they need to reach out to the claimant to ask more questions, they will. And you want to make sure that you do correspond with that. Make sure, you know, you do work with us, because 50% of our cases are denied because of lack of information. So it's not because of a medical issue, it's because we didn't get enough information from you. And so they might ask for additional information. In fact, they might even make an appointment for you to come see one of our doctors, just so that we can do an evaluation to see if you're actually disabled or not under Social Security rules, right? So you want to make sure that if they contact you, you want to make sure you do respond back, because again, that's a lot of cases that just get denied due to lack of information, right? So you want to make sure that you do that. Now, the next slide talks about the 5-step process. Now, as you're aware, I've been with the agency a while. I've taken a lot of disability claims, and the most common question I get is, when should the common question I get is, I only have 1 or 2 conditions, and so will I get approved? Well, I always say you want to list everything. If you have anxiety, if you have back issues, if you have kidney issues, if you have diabetes, high blood pressure, you know, whatever the situation may be, learning condition, right? You want to list everything. Don't just list 1 or 2 things, because we don't really know. You know, we're meeting you for the first time, right? And we're going by what you're saying in your application. So again, I always say to try to do this online, because when you do it with us on the phone or in person or however, you 2 ways, right? Phone or in person with the Social Security office. And right now you could only do it over the phone. We only get a limited amount of time to do your claim. So we only get about an hour, hour and a half, right? And that's your entire history that we need to get in an hour, hour and a half. That's not enough time. So if you go to our website, socialsecurity.gov/disability, and start doing it online, you can actually save your application. You'll get a reentry number. So if you need to go back in, you use your reentry number and you finish it up. And you could take about a week to do it. Once you're ready, once you know that you're ready and you have all your information in there, then you can actually submit it and you'll get a confirmation number. Like I said, 50% of cases are denied due to lack of information. Why? Because you feel rushed, right? You only have an hour. So you want to make sure that you take your time, right? Because this is your disability, this is your application, and you want to make sure that it's correct. So you want to go ahead and put in any and all conditions, right? Because now there's a book that I'm going to send you. I'm going to send this link out, and it's going to say the Red Book. And the Red Book is an entire history. It's a list. So if you're trying to fall asleep at night, this is your book, okay? It's a list of all of the disabilities that Social Security or the Disability Determination Services looks at. And this is, they have physical and mental. So you have physical conditions and intellectual conditions. And then you also have children and adults. So again, this is a very lot of information, okay? So if you're trying to fall asleep, I got you, unless you're really into this stuff. And I'll send you the link on that, okay? Because the next question is your medical condition severe? So how do we know if it's severe or not, right? What are we referring to? Well, this is all public information, like I said. So I'm going to send you the link so you can see what we're looking at with severity. And then, does your impairment meet or medically equal a listing? So again, you might not meet a listing exactly in that book, but maybe a combination, right, of your disabilities could equal that listing, right? So it is important to understand that you want to list everything, because you might not, 100% equal something, but maybe a combination of things, or even, even if you file, you want to go ahead, it could possibly equal it, right? It could be close enough. Now, the fourth one is, of course, can you do the work you did before? So I get a lot of people that apply for benefits and, they might have had a full-time job, right? And then they were diagnosed with something, or they had kidney dialysis. They have to go through kidney. They had a heart condition, or, so can you do the work that you did before, right? Because if you're working, can you do the same sort of work, right? You probably can't, depending on whatever your condition is. If you had a heart condition and you were a truck driver, you're probably not going to be able to go back to work, right? And not that job, maybe a different job, but not that job, right? And then also, can you do any other type of work? So not only do we ask you about your previous job history, right, for the last 15 years, if you can remember, but also your education. And the reason we look at education is because we want to know if you could do any other type of work. So again, the limit if you're working is $1,260 a month gross. So if you're making more than that, you're not eligible. But if you're making less than that, we will go on to step 2. Is your medical condition severe? Again, it has to last for at least 12 months. So again, that 12 months is also a factor to see if you get approved or not, right? And then again, meet or medically list the listing that's going to be on your blue book. Sorry, I mentioned red book. I'm going to send you a red book and a blue book, but the blue book is the disability questions. It's all the disability impairment listings. Okay, so again, they'll be looking at that, which you'll have access to, because everything I'm sending you is on our website. It's all public information. And then, can you do the work you did before? As I mentioned, that's going to be looking at your previous job history and what you can do now based on your condition. And then other type of work, that's why we look at education, okay? Now, the next slide after this tells you what we're gonna do afterwards. So you're gonna get a decision, and it usually comes out in the mail. You'll get a letter letting you know if you're approved or denied, right? If you're approved, we'll let you know what to do next. If you're denied, you have the right to file an appeal. You have 60 days to file one. And the next step would be a reconsideration. So you want to make sure you get it in within 60 days. You can do it all online. You can even see your letters online. I had one claimant, he calls me every day. Every time he sees something new, he sees a new letter, he calls me up. So I know that it updates online because I got a call from him almost every day. So I will say that, it's pretty much up to date. And also, if you need to file your appeal, it'll guide you to do that. As long as, you go online, you can see that it was denied, as long as it's within 60 days. So the first level of appeal, if you are denied, is a reconsideration. Again, a lot of people get denied because they didn't give us enough information. That's the most common reason. And that means a reconsideration is when it goes to somebody else, a peer of whoever did the first disability review, right? It'll go to someone else, and then they'll review it for a reconsideration, right? And then the second level of appeal is a hearing. So if you get denied, you can go in front of a judge, administrative law judge, and they would be able to hear you out. So you want to make sure if you do have to file an appeal, you take care of it within 60 days. You have 2 months, because past 60 days, you're going to do a brand new claim. And I don't recommend that, because if you can get an approval with an appeal, you get all that back payment. But if you start from scratch, you're losing all of the payments that you could have gotten if you had filed an appeal, okay? Now, the next slide after this talks about family benefits. So if a person is on Social Security, let's say disability, this is really particular to disability. The next slides I'm going to go over is supplemental security income. But let's say you have somebody who has worked and paid into Social Security enough, they file for disability, and they're married. So let's say that their spouse, who they're married to, haven't really worked and paid into Social Security that much. So that spouse can actually get benefits off of the person who's disabled, who's applying, who's already receiving disability. They can get benefits off of their record. They can actually get it as early as 62 if their benefit, if their own benefit as the spouse is less than 50%. So you can get benefits off of a spouse. Even divorced spouses can apply as long as they're 62 years old and they were married to them for more than 10 years. So 10 years or more is for divorced spouses. However, if the divorced spouse got remarried, let's say that you're not remarried, but your ex who wants benefits off of your record, they're remarried, then they don't qualify because we have to go with their current spouse. So it doesn't matter if you're remarried or not, but it does matter if the other person is remarried, because then we look at their current spouse. So, and again, this is similar to retirement because Social Security pretty much will pay you for retirement or disability. So family benefits are similar, but also they can also pay a spouse that is taking care of a child and care benefits under the age of 16. So if you are married to somebody and you have young children and your spouse is not able to work full time or not make more than another limit, the retirement limit this year, or the spouse's limit this year is it's 17,640, which is about 1520 a month. So as long as they're not making more than 1520 a month, they can actually get child and care benefits if they're taking care of a child of yours that's under 16 years old. And you can be on disability because you have an active record through your disability. Now for minor children, let's say you file for disability and you have minor children, your children can get benefits without them having a condition. As long as they're under the age of 18, or if they're still in high school until they're 19, they can actually get benefits as long as that they're minor children. Okay, now if your child is now over 18 years old or no longer in high school, or not 19 and in high school, they're over 18, then they can look into it with the child, the disabled adult child. So that's what I kept mentioning. If you have a child that's disabled before the age of 22, and maybe they're on SSI benefits, supplemental security income, because after 18, we no longer look at parents' income for the financial screening, then now the parent has now filed for disability or retirement. They're actually filing two claims, one for themselves and one for possibly a child that could be a disabled adult child, a dependent child. Okay. Now the next slide after this, again, this is a federal benefit. So if you break the law, if you have an outstanding warrant out for your arrest, or convicted of a crime, or violate a parole or probation, a condition of your parole or probation, you're not eligible for these benefits, okay? So just know that you got to make sure you stay under the radar. Don't do anything crazy. Now, the next slide after this talks about working while you're receiving benefits. And we encourage people to go back to work, whether you're getting Social Security, disability, retirement, or even supplemental security income. If you're on disability, you want to go back to work, we want you to work. You could even report your wages online. We also have the monthly wage reporting app for supplemental security income. So if you have somebody that's working, you can actually use that online with their My Social Security account. But we have a program that's called Ticket to Work. And this helps people go back to work if they want to. Before the pandemic, I used to go out to Centera, Norfolk, to their kidney transplant unit every 2 weeks. And I would do that because you have these people, they're now on disability, they're now on Medicare because they have to go through kidney dialysis, but they were working before and they want to work. And so the Ticket to Work program will help you get vocational rehab, free training, completely free, if you're on Social Security or supplemental security income disability benefits. So if you're on benefits and you want free help, free vocational rehab, free training, you can actually do that. And I'll provide that link to you as well. Now, we also have other work incentives. For example, let's say you're working as a cashier or a bagger at the local grocery store, something very simple. And you're working, but you can't drive, or you need to take meds, right, because of your condition. and in order for you to function to work, right? Well, if you have to pay a cost, let's say you have to pay transportation costs, right? Let's say you're making $1,500 a month, but you have to pay part of your wages towards transportation costs or a copay. We will not count that cost against you. So you need to keep a paper trail, keep receipts, because if you are working, you want to make sure that we don't count that towards you. So instead of counting $1,500, if you're spending $300 a month for transportation, we're only going to count $1,200, right? So you want to make sure that you keep receipts. So we do have special work incentives for people that are trying to work but have out-of-pocket costs, so that they can work. We also have something called a trial work period, which you can kind of test to see how much you can make. That's really through Social Security benefits, not SSI, not supplemental security income. But I will also send you a link on that too. So the work incentive information is the red book, and the disability information is the blue book. So again, I'm going to send you two different types of links, and you'll be able to see that on the organizational webpage. Okay. So the next slides are going to be on supplemental security income. And supplemental security income, again, is based on need, okay? So there's a financial screening involved, and then there's also Medicaid, right? Different than Social Security. Now, the next slide defines what supplemental security income is. So SSI is a federal program. So supplemental security income is a federal program that provides monthly payments to people who have limited income and resources. So financial screening is involved. If you're under the age of 18, if you have a child that's under the age of 18, we look at parents' income if parents live with the child. If the child lives with a grandparent, an aunt or uncle or a friend or whatever the case may be, we're not looking at anyone else's income other than that child. But if the child lives with parents, we look at parents' income. So a lot of times, if this child is going to have a condition that's going to be lasting them until, like, you never know when it's going to end, then a lot of times people file at 18 because they were denied as a child because we looked at parents' income, right? Now, who is it for? It's for people, of course, that are 65 or older. So if you're a senior, you can apply without a disability, but you do have to meet the low income requirements. For children or adults, though, you do have to have a disability if you're under 65 years old, okay? But if you're 65, we just look at your income. That's all we're looking at is income, and of course, citizenship and resources and the same financial screening. Now, the next slide after this gives you the requirements for getting supplemental security income. So you have to have limited income or resources. You have to be, if you're applying just without a disability, you have to be 65 or older. Or if you're not filing at 65, you're not going to wait that long, you can file for blindness or disability. And again, the same rules apply for adults. The condition has to last for more than a year, okay? So it has to be severe. And if you're working, there is a limit to how much you can make when you first start your application process, and it cannot be more than $1,260 a month. Again, it states on here the rules are different for children because children can't work legally. You can't really put them to work. So we look at school records. We look at IEPs and, doctors and stuff, but we also look at school records. So the next slide after this, again, defines disability as an adult, which I mentioned is the same as the other one, the same Social Security disability and SSI. The disability requirements are the same because we send it out for a medical review other than for children. Of course, we send it out for a medical review for kids too, but we're looking at school records. But the financial stuff is different, right? So the next slide after this talks about your financials. So we're looking at your income. So the person who's applying, let's say you have a person who's 18 years old, okay? And they're applying, they're an adult. We're looking at their income. If they're married, we look at spouse's income, but we're looking at their income, money you get, such as wages, Social Security benefits, pensions. Unemployment will also be something we would look at. As I mentioned, that's different than Social Security disability insurance. Income can also include things such as food or shelter. So if somebody's paying for your food, not food stamps. Now, food stamps is also based on need, and it's not money. It's only for food. So that's not considered cash assistance. But if somebody actually is helping you with cash, they're giving you money every month to help you pay your bills, then we count that as income, okay? Also resources, so your assets. We're looking at things you own, such as real estate, if you have a house or if you have two houses, bank accounts, cash, stocks, bonds, mutual funds, US savings bonds, all of that good stuff. So we're looking at your assets, and of course, where you live. So think about, for Social Security, you've worked and paid into it all your life. So if you want to move to the Caribbean and you want to you want to stay there, as long as you're a US citizen, you'll be able to get your disability check anywhere because you worked and paid into it through Social Security. But if you're on supplemental security income, which is based on need, you have to live in the United States or a United States territory. If you're not a US citizen and you're lawfully in the United States, there might be some sort of conditions and stipulations, but we are looking at you to be a US citizen for the most part and living in the United States. You can get it as a refugee, asylee, depending on your situation, but you would only be getting it on a conditional basis. You can't get it if you have a green card and you haven't worked and paid into Social Security enough either. So there are some rules, but really, citizen living in the United States and or a territory in the United States. Now the next slide talks about income. So we break it down in two different categories: earned income and unearned income. And with earned income, you earn wages, right? So when you're working, you're earning it because you're working. So we do count. So earned income is considered wages, self-employment, or payments or services in a sheltered workshop. So again, you're still working for this. Unearned income is calculated differently. So that's why they're in a different category. So Social Security, so let's say a person filed for both SSI and Social Security. We look at that Social Security once they're approved to see how much we can pay in SSI benefits, because supplemental security income can change because it's based on need, right? Veterans benefits, unemployment benefits, interest, pensions, and cash from family and friends. So when we look at earned income, the calculation is different. So the first $85 that you make with your job or self-employment net, but if you're working and you're making, let's say, $100 a month, okay? You make $100 a month gross before taxes, before anything is cut. We're not gonna count $85 of that. Okay, so that means that we're only going to count $15 because we're subtracting $85 from 100. So if you're making less than $85 a month with a part-time job, then you're fine. But if you make more than $85, we subtract 85 from it. And whatever's left of that $15, what we do is we divide it by half. So we're going to subtract $7.50 per month from your supplemental security income check, right? Because from whatever you're getting, because of your income, because of your earned income. So that's your calculation. If you're working, we're not counting $85, and then whatever's left, we divide it by half, and that's what we're deducting from your full amount. So if your check is gonna be $783, we're going to go ahead and subtract $7.50 because you're working and making $100, right? So not bad. So an unearned income is calculated differently. So we're not counting $20. So let's say you have a Social Security check and your Social Security check is $100 or your unemployment is $100, right? We're not counting 20 of it. So that means we still count 80. All right. So if you're getting a check, let's say of $783, which is the amount that you can get in the maximum you can get in 2020 with SSI, supplemental security income is $783 without any deductions. So that's a full amount. We're going to subtract $80 from that because even though you're getting 100, we subtracted the 20. Okay. So $80. So we're going to count 80. And instead of getting $783, you're going to get $703. because we're not going to, we'll deduct $80 because you're getting $100 of other income. Okay, so that's the calculation between earned income and unearned income, because there's a lot of confusion. There is. People want to know how it's calculated, right? Now, resources is the next slide. And resources is also categorized in two ways: included and excluded. So I will say, if you're single, let's say you're an adult and you're single, then you can have assets up to $2,000. And if you're married, you can have assets up to $3,000 as a couple, okay, as if you're married. All right, so we count bank accounts. So if you have, because supplemental security income looks at assets, right? So if you have bank accounts, stocks, bonds, mutual funds, anything like that, we have to see what's the value of that. If it's more than $2,000 total, you're not eligible. If it's less than $2,000, you're still good. If you are allowed to have a car, you're allowed to have one car, and of course you're allowed to have your house. If you own a house, you're allowed to have it, because we understand it's a hardship. You got to live somewhere, right? So if you own a place, that's okay. But if you have two places, yeah, it's based on need. So we're going to count the second place that you're not living, right? And then a car, if you need a car to get you around town, to go to the doctors, hospitals, school, work, whatever, you're allowed to have a car that you're using. But if you have two cars, we would have to look at the value of the other car. Okay, so that's how that's looked at. Life insurance policy. When we're looking at life insurance, we're not looking at your face value. So whatever, if something was to happen, you'll get $100,000. We're not going to count that, because that's not an asset to you, right? We're looking at cash surrender value. So if you have a life insurance policy that you can trade in for cash, right? What is that value today? So that's what we're looking at. And again, let's say you have a life insurance policy that you've never really touched, you've always paid into it, and if you traded it in, you'll get $2,000, right? That's right at that limit, right? We will not count $1,500 for burial. So if you're actually excluding some of the money, if you're actually going to use some of the money for burial because your family will, then we do not count. If you notice under excluded resources, some resources set aside for burial. So the burial exclusion is $1,500. So if you have a life insurance policy of $2,000, but you're gonna, you have that $1,500 exclusion, okay? And again, second car. So burial plots for friends and family, or for family, for self and family, and also resources set aside for burial, that's going to be a $1,500 exclusion, okay? So life insurance kind of goes with that, but we're not looking at face value, we're looking at cash surrender value. So how much is it worth to you today while you're living if you wanted to trade it in, because that could be an asset, okay? So that's resources. And then the next slide goes into living arrangements. So again, living arrangements, now this is tricky because we have different categories for living arrangements. As I mentioned, you're a baby, you were in a hospital because of low birth weight or something. When you're in an institution, as you can see, you only get $30 a month. And that's if Medicaid is going to pay more than 50%, because Medicaid is going to cover all your bills, right? They're covering 50% of your bills while you're in the hospital. So you get $30 if you're in the hospital. Now, if you live in your own place, you got to pay your rent, or you're living with family or friends and you have a roommate situation where you're still responsible for paying your share of the bills, or you have a lease agreement to pay room and board, then that's one situation, right? So that's living in your own household, right? If you're living with somebody else and they're covering all your bills, then there is an exclusion. Well, there's a amount that we count, okay? It's 1/3 of the full amount. So like I said, it's $783 is the full amount this year in 2020. If you are living in somebody else's home and they're covering all the bills, you're not going to get $783, you're going to get $522, okay? Because we don't count it dollar for dollar, because we understand that rent and mortgage and all of that, it's going to cost more than $783, and you want to be eligible for payments. We want to make sure you're eligible for payments. So we'll count 1/3 of the $783, we'll deduct that, And that's what ends up you getting $522. So that's how you get $522. So remember that it's depending on your living arrangement situation. You still do something, which means you still get Medicaid, because even $1 worth of SSI will help you get Medicaid through social services. But it depends on your living arrangement situation. Again, if you live in a group home, group care, we look at, how that organization handles billing, right? So again, everybody's situation is different, but this is how we look at living arrangements. Now, the next slide after this, so again, let's say you're living with 4 people. We look at your share of the bill. So if you're not able to cover your share now because you have no income, but now let's say you get approved for supplemental security income. Well, then we look at what the household bills are for, like your mortgage or your rent, your water, electricity, gas, your basic necessities. And then we divide it by how many people are in the household. And then if you could meet your share with whatever check you're getting through supplemental security income or any other income through part-time work or whatever, then you're fine. So that's a big gray, because people tend to ask a lot of questions about living arrangements. So I will say that if you're taking care of somebody and you're covering all the bills, then that's a set amount. Versus if they're paying their share of the bills, you can always report that in. And the biggest takeaway I want you to take from this slide is, what do you need to report? You need to report everything within 10 days of a change. So let's say you had somebody who was not receiving benefits, no money, not working, they're not able to work, and they applied for benefits, and now they're going to start getting $522 because they got approved, right? Now, if they start paying their share of the bills in the future, once they actually start receiving a check, you can let Social Security know about that, and you have 10 days to keep us posted. So reporting responsibilities are huge, all right? The next slide is the entire list. So as you can see, there's a lot of things to report with supplemental security income because it is based on need, whereas Social Security is based on work, right? So again, if you move, changes in living arrangements, how much you're paying in bills, if you get married, you go to jail, anything like that, immigration status, you would have to let us know. So definitely you want to keep us posted with income, resources, living arrangement. You made the lottery. Let's say you hit the lottery. You got to let us know about that. You buy a second house, you get some stocks, bonds, you start working somewhere. You want to let us know because that's income, right? Or if you applied for a benefit and it's cash, not food stamps, but another type of benefit, you want to tell us. So you have 10 days to let us know. If you go into the hospital and then you come out of the hospital, you want to let us know about that too, because that could affect your living arrangement. So definitely keep us posted on any and all changes. And the next slide after this is just a nice reminder that it is based on need. So again, you want to keep us posted. If you do get in trouble with the law, you're not eligible for these payments, okay? Now the next slide after this talks about children, and I'm going to briefly go over this because I see we're almost done with time. So a child, if they're under the age of 18 and the child has a physical or mental condition, of course, they can apply for benefits, okay? The child must be either blind or disabled. So medically, that child, could possibly meet the medical requirement. But remember, for supplemental security income, they also have to meet the non-medical requirement. And for children, it is parents' income. So if they live with their parents, we look at that. And again, the condition has to last for more than 12 months. So it has to last for more than a year. Now, the next slide talks about, we have a lot of people that are eligible for benefits. We have a lot of children that are eligible for benefits because of low income, because maybe they don't live with their parents, or maybe, their parents are low income. Maybe, they met that qualification. What happens when this child turns 18? Well, when this person turns 18, you're going to deal with 2 reviews. You're going to deal with a medical review, because now we're looking at them as an adult. So now a new medical review has to be done, which we'll contact you about directly. You don't have to do anything on your end. So we will contact you, get you all the paperwork that we need to now get the medical review started as an adult. because we have to look at work, right? If they're able to work, right? And doctor's records and all of that stuff again, as an adult. And then also we'll do a non-medical review, to see if they still meet the financial, right? We have to do a financial screening once they turn 18 to see if they actually are covering their share of the bills, or if they are working, how much are they making? So again, we'll be looking at all of the income resources and all of that once they turn 18. Now the next, I'm going to go ahead and run through some slides. The next slide is SSI and foster children, which you'll have a copy of all of this, so I guess you'll be able to scroll through it. The slide after this is homeless, which I will touch base on. So a lot of times, because people are based on need, low income, and a lot of people have intellectual disability, unfortunately, we see a lot of homeless cases, right? So when we see something like this, we define a transient or a homeless person as an individual with no permanent living arrangement, meaning no fixed place of residence. They're not a member of a family or an institution or anything like that, okay? But we do ask that they have some sort, because there's no mailing address, we do ask that they have some sort of prepaid debit card or some sort of electronic card. They might not have a bank account, but we do provide a Direct Express card as well, with a MasterCard logo on it, and you could use it wherever MasterCard is used. Because if we're going to be providing money, we want to make sure it's going to somewhere stable, right? So we do ask that they have some sort of direct deposit or somebody that they trust that can help them, so that they can handle their money. Now, the next slide after this talks about, well, how do you apply for SSI as an adult? So these are the requirements. As I mentioned, you have to be between the ages of 18 and 65, never been married, a U.S. citizen, never applied for benefits in the past. And the way you're going to do it is you're going to go through the disability portal. So you're going to do ssa.gov/disability, right? And then you're going to apply based on that. And then it's going to ask you, are you interested in filing for supplemental security income? You say yes, okay? And then you go through the financial questions there. And then it'll take you to all the medical questions. Now you're also going to get a copy, a nice little cheat sheet of a link. So that way you'll be able to see the medical questions ahead of time. It's always nice to have a little cheat sheet. Now the next slide after this, which I'll provide as the follow-up. Also, how to apply for children if they're under 18. If they're under 18, they do have to do it over the phone with us. You cannot do it online. You do have to make an appointment. And you can look at the disability report form. You could fill that out ahead of time. And there's a link for the child disability report on the slide. And then the next slide just talks about what happens next. Of course, you get a decision letting you know if you're approved or denied. If you're approved, great, you start your benefits. If you get denied, you do have the right to file an appeal. Remember, we're going to contact you, and with supplemental security income, there's a lot more questions, right? Because it's based on need. So, don't be alarmed if we're sending you letters asking you to fill out things or come into the office, or, well, right now, do things with you on the phone, is because if you've contacted us, we will probably call you. But if you haven't called us, we will not. So remember for the scam stuff. But if you've contacted us, we will get in touch with you to provide you customer service. So again, we will probably ask you to do things on the phone with us so we can do financial screenings and reviews and things like that. So just be aware of that. Now the next slide talks about non-citizen requirements. So I'm going to go ahead and skip over. The next slide talks about qualified aliens. So I'm going to skip over that. And then the next one is just a continuing. So I'm going to skip over that. Again, qualified aliens again. So we're going to skip over all of this. And we're going to go to the next slide. And I think there's a ticket to work. There you go. So that's what I was talking about. So if you want to know about medical, vocational rehab, how you can get job training for free. You know, if you're on Social Security disability benefits or supplemental security income, with supplemental security income, there's also another program. It's called Plans to Achieve Self-Support. So that's called PASS, Plans to Achieve Self-Support. And so there's the PASS program, and then there's the Ticket to Work program, which is free. And again, that's the link to how you can look up to see which area, who we've partnered with to get medical help, to get, work help, vocational rehab help. Okay. The next slide after this lets you know that we're going to tell you your decision. Of course, we'll let you know if you're approved or denied again. You will be able to do that in the mail, or you can log in. And the slide after this, I'm just going to quickly touch base on. The next slide talks about the differences between Medicaid and Medicare, because both of these terms, both of these insurances are used interchangeably. So Medicaid is state health insurance for people with limited income and resources. And if you remember, I said if you're on supplemental security income, you pretty much have Medicaid, right? That's an automatic thing. But if you're on regular Social Security, you paid into Medicare, right? So Medicaid is based on need. It's through the state. You do have to apply separately in the state of Virginia. So if you get approved for supplemental security income, you do have to contact your social services to see if you qualify for Medicaid. And then Medicare, again, is federal health insurance because you worked and paid into FICA. Usually people think about it when they're 65, but you can get it earlier if you're on regular Social Security disability. Let's say you're 30, you had a car accident. After being on it for 2 years, so after receiving checks for 2 years, once you hit 32, you can actually go ahead and get Medicare Direct. Will automatically get you the Medicare card in the mail. So you do get it after 24 months of being on regular Social Security disability. If you are diagnosed with Lou Gehrig's disease or going through kidney dialysis because of end-stage renal disease, you can get Medicare even before 65 or 2 years or whatever the case may be. Again, Medicaid, as I mentioned, in most states, children get it as well if they're getting supplemental security income. And also, even as an adult, it's pretty much automatic, or you'd have to apply separately. But if you get even $1 worth of SSI, it helps with the Medicaid. And the next slide just reiterates that. And then the slide after that is going to be the representative payee. So as you can see, we have millions of people that are on benefits. Supplemental security income alone in the state of Virginia, we're looking at over 150,000 people that are receiving supplemental security income. And then Social Security disability, we're looking at over 1 million. So just know that you have a lot of people that are receiving these benefits, and about 8 million of the people that are on disability benefits need somebody who's going to help them care for their food, shelter, clothing, their finances, because maybe they're not able to do it because they have a mental or some sort of intellectual disability, right? So it is important to understand that we do have this in place. It is not the same as power of attorney. It is not the same as that. So representative payee is something that we have through Social Security, and it can be a relative, a friend, anybody that this person trusts, okay? We prefer it to be parents because, of course, parents would have the best interest. So a relative or anybody that they trust, and they will have to make sure that the money is used for their well-being, for food, shelter, clothing, basic necessities, right, for whatever they need. And again, we do a background check on whoever's applying because we want to make sure that this is a person that's trustworthy. I mean, we get a lot of fraud cases, not only phone calls, but just with money, So we want to make sure that, it is somebody that we can trust. So we do a criminal background check on whoever that's filing, even a parent. Just to make sure. Now, if you're not a parent and you're a payee, every year you do have to go ahead and provide checks and balances, like a reporting form that we send out so that you can go ahead and make sure that we know how you're using the money, right? Now, it's excluded. Parents are not. They used to do that, but now they don't have to. And you can even get that form online. Also, when you're filing for benefits now, the person who's applying, they can actually appoint it's called advanced designation. And they can actually appoint 3 people that they trust right in the beginning of their claim, during their initial claim, that they would want to be their payee if they ever need one. It doesn't mean that they're going to need one, but you can appoint 3 people that you trust. So it could be a parent, it could be a child, it could be anybody that they trust that's over the age of 18 and hopefully doesn't have a record, right? So you have that. And then also, even when you're on benefits, let's say you want to change your advanced designation, right? You want to change whoever you want to be your payee in the future. You can change that, and you could do that online as well using my Social Security services. So again, I will be providing links to everything. So the next slide is a little fun slide. And it's pretty much, we do all sorts of webinars across the community. I cover a lot of cities in Virginia, but we have a bunch. There's somebody in Richmond, there's Maryland, there's a person and all over the United States, Texas. We always have people that come out and do these webinars and seminars. So if you want to request one for your organization, there's a link to that as well on the screen. And also, I will be providing links to everything that we talked about. And of course, you'll have a copy of this along with, of course, what NAMI Coastal Virginia has been nice enough to sponsor me. And I just kept going with all this information. But they will be actually placing this on their organizational website as well. So it is recorded and they will have this as well. So thank you so much for having me today. I hope you guys got a lot of good information out of it. And I'm going to give it back to Jen. So thank you.
Liz, I cannot thank you enough. This was such a feast of facts. We are all so much better for hearing your presentation. It is a lot of information, and I do want to just reiterate that it is going to be on our website, www.namicoastalvirginia, Virginia spelled out, .org. It'll be on the front page of the website under Coastal Chats. Coastal Chats. It should be up by the first of the week, and you can look at it at your leisure and share it with whomever you like. For everyone who was registered for the program, the supplemental information that Liz talked about, we will send that to you in the form of an email. And finally, if you do have questions, I know you probably do, please call the local Social Security office, or you can go on their website, www.ssa.gov. Liz, thank you so much, and thanks everyone for attending. We really appreciate it, and we look forward to helping you in the future with your mental health needs. Good night, everybody.